Welcome back to Why We Nurse. I'm your host, Serena Tovar, and today we're stepping into one of the most intense and fascinating places in healthcare, the operating room. I'm joined by Amelia Waddington, a current nurse resident navigating the fast-paced world of surgical nursing. From nursing school to the OR floor, we'll explore what it's really like to transition into this high-stakes environment and how residency is shaping their journey. So let's begin with your journey. What inspired you to pursue nursing, and how did you end up in the OR residency?
So, my mom was actually working in the OR for 45 plus years. And she's been trying to talk me into going into this for the last 15-ish years or longer. And I guess I wasn't ready. And then COVID happened. So I went back to school and I started with psychology. And then I thought, oh, I think I might like nursing, like my mom had been telling me. So I went to the nursing program and then I did my clinicals and loved the OR. So she was right.
Moms usually are.
Yeah.
What was the transition like from nursing school to the OR? Was it what you expected?
I'm not gonna lie, it was not what I expected. It was a lot more than I expected because we don't really learn anything about the OR in school. So it was like, it's pretty much like I'm in school still. It's a whole new set of things to learn. And I felt like in school they were teaching us more bedside nursing, which doesn't apply as much in the OR.
Right?
It is. It is. I mean, yeah, it was a big transition. I'm
I
glad I'm
remember,
in the residency program and not just thrown in.
I do remember being in school where I had an opportunity to go to the OR like one time while I was in school, and it was a super fascinating experience. They were doing a cardiac bypass, and they were doing it on a warm beating heart. So, patient was hooked up to the machine that was circulating the blood for them,
Uh-huh.
and it was. The surgeon was so cool. He was like, "You, nursing student, come stand right here." So I was like right next to the surgeon. They cut open the chest. Smelled terrible. Horrible smell. The most horrible smell I've ever smelled.
Lots of smells in
And, and
there.
then you could see the lungs just.
Yeah.
And I was just amazed. And
Yeah.
no, I didn't want to be an OR nurse, just to be honest. I didn't want to wear that mask. So COVID was kind of like that little slap in the face, like one of those karma kind of things. You didn't want to wear a mask? Well, here, now you got to wear a mask all the time.
Yeah. Yep. That would trained me right into it.
Okay, so can you walk us through a typical day in your residency?
So I'm still following a preceptor-ish. I'm kind of moving on to doing things on my own a little bit more. So I first get there and they go over where we're going to be, our assignments for the day. And so we go into the room because they're very strict about getting started on time. So we go into the room and we set up everything, and it's a lot of sterile field stuff. Get medications, check the patient chart, and then we have to interview the patient. We go pick them up and interview them at the same time, bring them back to the OR. But it's a big setup in the morning when we first get there. And it depends on the case, but sometimes we can do one case. It lasts all day. And then sometimes we finish a case within a couple of hours and then clean up and start the whole process all over again. Setting up, sterile, getting the medications, going to get the next patient, interviewing them, bringing them in. And so I've done, I think, maybe 5 cases in one day, and that was a busy, busy day. But it's, yeah, a lot of setup.
I can just imagine. You have to keep everything sterile and just be extra cautious with what you're
Yes,
doing and how you're doing it.
right. That's a lot of learning right there on its own. Because we learned a little bit about sterile field in school, but this is, I mean, half of the room is sterile, and then you can't touch half of the people in the room because they're sterile. So it was a lot of learning.
So what kinds of procedures are you involved in?
So we do the heart is in a separate building, so we don't, that's a separate team. So we do neuro is big, and then a lot of general cases. And so in general, it can include like urology cases, gynecology cases, a little bit of plastic surgery, a little bit of orthopedics, a lot of gallbladder removals, a lot of gallbladder removals. But I really enjoy neuro, so I'm glad that we have a lot of neuro going on.
I just think about the gallbladders. I bet, like, as Americans, we don't have the best diets and we eat a
Yes,
lot of fatty foods and put our
yes.
gallbladders into overdrive.
Yes, I don't even want to know what mine looks like after some of the ones I've seen. I don't even want to know what mine looks like.
And I know I have stones, but they don't
Mhm.
bother me. So the doctor's just like, if it's not broken, let's not try to fix it.
Yeah, yeah. Good
I'm also
plan.
guilty of being one of those Americans who doesn't eat the best.
Yeah,
And
it's hard.
so I totally understand where our patients are coming from.
Yeah,
But
me
yes, I
too.
can imagine those gallbladders look pretty interesting.
Yes, a stone came out. It was probably like this big, and I thought, that's inside of a body.
Oh wow,
That was
that's humongous.
nuts. Yeah, yeah, it was big.
So what's one skill or mindset that you've had to develop quickly since being in the OR?
Anticipating needs. That I'm still trying to figure that out, but it makes it go a lot smoother if you can kind of anticipate what's needed for the case, what the surgeon likes to use, the kind of medications that we may use just to have them in the room. So yeah, anticipating the needs for the case is the biggest, I think, thing that I've been learning,
Do you
which
feel
is
like you are starting to be able to be like, oh, Dr. Jones likes this, and you can kind of have that ready for them?
yeah, so I've taken a lot of notes. So I bring my little notebook with me, which helps a lot. But yes, it is helpful that most of the surgeons prefer the same things for their cases. So, like, if Dr. Jones wants to use this instrument and he uses this instrument for 90% of the cases, I'm going to have it in the room so that it's there for him. So, yeah, it's getting better. But I have a whole notebook I carry around with me.
It's probably a smart thing.
Yes.
So, how has this residency program supported you, like with mentorship, training, emotional support?
I think it's really helpful to see the same faces because we still have seminars, not the site, but the regional seminars, but even the site seminars and even my peri-op class. It was really nice and comforting to kind of see the same faces once, twice a month and know that we're all kind of going through the same kind of stuff together, even if we're not in the same area. Because I've talked to people who are in ICU and it's the same type of struggles that we're all kind of having together. So it's just nice to not be alone. So that's very helpful. And then everybody who's been doing the seminars is really supportive and comforting and asking if we're okay. And so that's been really helpful too. And I also just really appreciate that we have this program because being thrown into anything would just be terrifying. I don't know if I could do that because I've heard people will go straight to working in bedside and I just don't know how. It's very helpful to have like learning and support and help.
And I was talking to Marla last week
Hmm.
on the podcast, and I was telling her kind of that exact thing happened to me. Like, I got my very first job, graduated nursing school, and 2 weeks of hospital orientation, and boom, here's your 5 patients. Here's a person you can ask questions to. She was not my preceptor, she had her own
Hmm.
5 patients.
Hmm.
And it's basically, you're on your own, sink or swim, figure it out. And it was right at that time, the very early 2000s, where
Uh-huh.
we were half paper charting, half computer charting, because we were making that transition to the
Uh-huh.
electronic health record. So that extra layer of stress on top of
Yeah.
not really having support and training, and nursing school is so different
Yes, it
than real
is.
world.
Yes, it is. Yes, it is. I fully agree with that. I don't know if I could have done nursing if I had gotten thrown in that way, like you did. I don't know if it would have been for me.
Yeah,
I think
and
it
that's
would
what
have
I was
been
saying.
overwhelming.
It was very overwhelming. I cried every day.
Yeah,
I really questioned, did I make the right decision with my life? Did I really want to be a
yeah,
nurse? Did I really want to do this for the rest of my life?
yeah.
People were mean to me, and I was like,
Yeah,
I'm
I
here
believe it.
to help people, and I wanted to be a nurse to be nurturing and caring, and the patients were like kicking me and they were grabbing me and cussing me out, and it was
Yeah,
just not what I had expected. And
right.
your clinical experience really doesn't prepare you for all of that because they give you the good patients that don't do that.
Yes, they do. Yes, they do. And they give you the good preceptor and the good everything. They make it perfect in clinical, just about.
Yes,
Yeah. And it's a lot different. There are struggles.
lots of struggles.
Yes.
And speaking of that, the OR, it can be super intense, right? And so, have you faced any moments that have tested your confidence or resilience?
I've definitely messed up for lack of knowing how to do things. I haven't really experienced anything patient-wise scary. I haven't experienced any codes. We learned about MH, and I have not experienced that yet. Yet, knock on wood, I don't want to. But for the most part, I can't think of a patient situation that has been scary or made me not feel confident. But as a nurse in there, I've messed up, which makes me lose confidence because I'll be on a roll for a few days where I feel, oh, I'm really learning, I'm really getting it. And then I mess up and it feels like I'm all the way back to day one, where it's like, oh no, am I good enough to do this? Is this for me? So yeah, not knowing and then messing up is, I think, the way I've broken sterility one time, and that was not a good day. That was a bad day. That was a bad few days because I was just overthinking it. Even though it was like at the end of the case and not a huge deal, but I lost a lot of confidence whenever I did that. Um,
Do you feel
Still,
the residency supported you through that?
yes, Alicia, my educator, is always super supportive, lets us vent to her, and she reminds us that we've all been new and we all need to learn. And yes, so that's very helpful to have somebody kind of talk you out of your head and what you're overthinking about. And then I'm in the residency program with another person too, and so it's helpful to be able to talk to her about what's going on because we're in it together.
That's wonderful. And I
Yeah.
think we all have at some point had that imposter syndrome.
Yes.
Even moving to like a different specialty. So,
Hmm.
my background is med surg, and when I moved into the education world, I had that imposter syndrome at first. Like, do I even know what I'm doing?
Right.
And I went to school to learn how to be a nurse educator, and I still felt like I have no clue what I'm doing. I'm not doing this right. They're going to see right through me. And
Yeah.
so we all kind of get in our own heads sometimes.
Yes.
And it's
Yes.
great to have somebody that can kind of talk you off the ledge and say, it's okay to make mistakes. And it's
Yes.
okay to learn from those mistakes.
Yes. Yeah. Key learning from those mistakes. I have not made the same mistake twice, so I am happy about that. But yes, mistakes have been made.
How do you handle the pressure of working in such a fast paced, high stakes environment?
I think I just talk to people about what I'm going through, and like I have my best friends and I talk to them. Yeah, I think I just talk to people. I talk through it with people and kind of vent it out. It is a lot of pressure though. I'm still learning how to deal with it, I think. I teach yoga, so that helps a little bit. That was my job before I started this, so that helps. But I think talking with people is the most helpful thing, just to be able to talk it out, get it off my chest, have other people tell me I'm not as crazy as I feel like I am sometimes. But yeah, I'm still kind of learning how to, it's a whole new world and I still feel very new. So I'm still learning how to navigate the pressure of the OR. It's a lot.
Yes, yes. I can only imagine. I, again, am not an OR nurse, but I just even being in there one time, it was a lot for me.
Yeah. I try to, when I do a case that I'm unsure of, I try to go home and kind of Google and learn about it a little bit because that helps me not feel as pressured the next time I come around to a case like that. So I think maybe doing extra learning about what I'm doing helps ease that pressure a little bit in certain ways, I guess. It's just a lot to learn. So the more I learn and the more I retain the information and I'm kind of getting it down, the pressure is going down a little bit at a time, but I'm learning.
And you said you do yoga. Do you recommend yoga or some other, maybe exercise to decrease that pressure at the end of the day?
I do because it's just so the yoga I teach, it's an hour long, and it's an hour where you just are kind of out of the real world and just thinking about the yoga. And even going on a walk, it's just, I mean, anything that you're doing with your body. Yeah, I feel like it's really helpful. Releases the endorphins, makes you feel good after, relaxes you even a little bit. Yes, it's very helpful. I really like yoga. I like to be able to teach it and give it to other people because I know everyone in this world needs that time to relax and decompress.
Yes. Yes,
So,
definitely.
yes, I will always recommend yoga or any kind of exercise, but yoga because I teach it.
What is something that you've learned in the OR that you didn't learn in nursing school?
90% of it, all we learned in nursing school was to make sure there was a consent form signed. And then the main skill we learned was Foley's, and we do a lot of Foley's. So everything else is new to me, and I'm just very lucky that I got to do a whole semester of clinicals in the OR. So I kind of got a jump start of what was going on because we did not learn anything in school other than consent and the Foley's. I don't do IVs. Yeah, we didn't learn anything about it in nursing school. I think most of the people that I talk to from my nursing school program don't have a clue what I do for work. So it was a whole new world.
So when you were like talking about earlier setting up the room, what
Hmm.
does that involve? For people who are not in the OR, because that's probably a lot of what you do, right? Is that setup?
Yes. Uh-huh. So there's different, depending on the case, there's different beds that we use for the patient to be transferred onto the OR operating table. And there's different ones, so we have to make sure we have the correct bed for the procedure because sometimes the patients will be prone, sometimes they're supine, sometimes they're in lithotomy. So if they're in lithotomy, we would have to get the stirrups and make sure the bed is set up to where you can take off the bottom half so that it's not in the way where the surgeon needs to be. So the bed is a big thing, and then the equipment, depending on the case, there's different equipment we use. So we have to make sure that's all in the room, on, working. The scrub tech is usually in the room with us. And also somebody with anesthesia is also in the room with us, and we're all kind of setting the room up together. So anesthesia will set up everything that they need to intubate, and the anesthesia will set up things to intubate and have their medications prepared and anything that they may need as backup. And then the scrub tech mostly sets up the sterile field, but we help open things to them because they're sterile, so they can't touch the outside packages. So it's a lot of instrument opening, a lot of equipment setup, like we have suction and Bovie, which is the cautery. So we have to turn that machine on. I don't know how to say it in a way. It's so weird to explain it because now that I know it, it's hard to explain it to somebody who doesn't, like a new person. Because I know I'm saying equipment, but it's not helpful. But there's so much equipment. I could spend a whole hour talking about just the equipment that we set up. But yeah, it's a lot of just helping the scrub tech open up stuff into the sterile field, keeping it sterile, making sure everything is working, and then making sure definitely, because what we did learn in nursing school was ABC, that the anesthesia stuff is ready to go because the patient has to be able to breathe during the surgery. So that's probably the main important thing to do.
And so I just learned something new from you right now. Like, I
Okay.
didn't know that there were different beds for the OR. I thought it was just one table. I don't know why. I thought they were like little, like stationary, like built into the floor. I didn't know like there's different ones that you can like move in and out of the room. Like, I had no idea.
Yes.
I thought they were just like built into the floor.
I thought that too. And even as a student, I thought that because I had seen the same kind of cases over and over. But now I'm learning there are beds for when you put them into prone position. It's almost like there's a cutout where the stomach is. And so you have support on your chest, you have support in your head, you have support in your legs, but your stomach can kind of just hang freely, if that makes sense. Like there's nothing, there's like a hole in the bed kind of. And so your stomach can just hang freely there. And I'm not really sure what the purpose of that is, but I do know when we put the Foley catheter in, the Foley catheter, we can drop the bag through that hole so it's not smushed into them. I guess I guess that would be a good point, is their area right there is not going to be smushed into the bed if
Right.
it's a 6-hour procedure or something like that. But yeah, I did not know. And the beds come apart, which I also did not know, because you can remove pieces and change them around. It's a lot. There are beds that I haven't even seen yet. So I've seen them in the back storage room, but I haven't seen them used yet. So yeah, that was a learning thing. I didn't know anything about stirrups and attaching them to the bed, or there are arm boards you attach to the bed. It's kind of cool, but it's just a lot to learn.
Yeah, like I said, I didn't even know there was different beds.
Yeah.
So just
Yep.
talking to you, I've learned so much.
Yeah. In the robot room, that's probably the coolest bed because it syncs up with the robot. And
Uh-huh.
so once it's synced up, you don't move the bed after that. Like the robot will go over the bed and it can like read where the bed is. And I thought that was really cool.
Oh, that's so cool. So how
Yeah.
many robot surgeries have you gotten to be in?
A lot. We have a surgeon who does almost all robot surgeries. He does general surgery, and he does a lot of he does robot all day long. So I've seen quite a few robotic surgeries, and I think it's pretty cool to see. But yeah, this is one that I was telling my friend about because she didn't understand where the surgeon is. And there's a console on the side, and they sit at it, and there's like eyepieces literally that go to their eyes like this. And when you look through it, because I got to look through it when I was new, it almost looks like a video game. And so they control with these controls the arms that are used with the robot, and I can see them like turning like this, and then I see on the screen the robot arm turning like this, and it's very cool to watch. It just looks like a video game surgery, but it's real life surgery, so it's wild, but very cool to watch.
Kind of almost like virtual reality, sounds like.
Yes, exactly like that. Yeah,
That sounds so cool. The
yeah,
technology that we have now, just in the last 10 years, is just amazing.
yeah, yeah, it is. And it's just there's so much technology coming out and all the AI and everything. Yeah. It's going to be weird how it's going to be 10 more years from now.
Oh, yeah, it's going to be a totally different nursing world. It already
Yeah.
is totally different from when I started. So
Yeah.
it's just how fast everything is happening and all these changes and
Hmm.
these new technologies. It really is just to make things more precise and more
Hmm.
accurate and make people healthier and better patient outcomes. But it's also
Yeah.
scary.
Yes. I agree. I agree because technology isn't always perfect. I know we aren't, but technology also isn't always perfect. So, yeah, I hope we don't ever rely on technology too much. I feel a mixture of us and technology is good.
Yes, yes. You
Yeah.
definitely need that human part of
Yes.
nursing for sure.
Yes. Yeah.
So, Amelia, was there a moment, like just a specific moment when you felt, I'm really a nurse now?
Yeah, the very short moments. I've gone through a few cases almost solo, and I'd say for the most part, I've gone through a few cases, robotic cases even, probably 95% on my own, and kind of just call my preceptor in if I need them. And when I've successfully gotten through those cases, I feel like a nurse and like I succeeded and did it. And yeah, but it's they're very short moments still. They're a little bit more frequent, but they're very short.
So it's really
I still feel
starting
an
to come.
imposter. It is coming, yes, but I still feel an imposter. Like, what is going on? This is a big, yeah, it was a big, I went from teaching yoga to like human lives, and they're cut open and I'm responsible for them. So it's a big, like, am I doing this right? Feeling. Big imposter.
Big imposter syndrome, but it's
Yes.
slowly going away through these small moments.
It is, yes. And I know as time goes, it's gonna go away more. But I also know from other people that I've spoken to that that imposter thing will kind of stick around here and there forever.
And I don't think we talked about it earlier, but how long have you been a nurse?
It's been 7 months, 8 months now, I think. Between 7 and 8 months.
7 and 8 months. And then how long is your residency?
So mine is longer than everyone else's. The OR goes until December, which is 10 months. So we have a 10-month residency program.
Okay.
Because then yeah, I guess we graduate in February at the year mark, but our I guess, orientation period is 10 months.
Awesome. So you get that extra support since you're in such a specialized area that you really didn't get a lot of exposure to in nursing school.
Yes, yes. Extra time to learn. Yes. Which I thought at first was silly and we didn't need it, but we definitely need it. I see why it's so long now. Yeah.
What advice would you give to nursing students who are considering the OR residency?
I actually have given this advice to people who were in the levels below me. When you're doing clinicals, advocate for yourself and what you are interested in and where you would like to rotate around to. I feel a big reason I got to be in the OR right out of school was because I would basically beg my teachers to please let me go to the OR. Please let me go to the OR. And then I got a whole semester in the OR. And if it wasn't for that, I'm not sure that I would have gotten the job in the OR right away. So I would say advocate for yourself and your interests and where you want to go.
Did you get to go to the OR for clinical where you're working now?
I did, yeah.
And do you think
I
that's what
did.
helped you get the job?
I
Getting to know the
do.
people?
Yes, I do. Even I was told that my semester where I got to do it all in the OR, so a couple of people made comments about how it was kind of like my job interview-ish. I got to kind of see how I worked. And so, yeah, I feel like if I didn't have that, I don't know that I probably would not have gotten straight to the OR. So I do think that that was very helpful. And I just will never forget my teachers who let me do that because I hear it's very rare to be able to go to the OR for clinicals.
It is, it is. And I also am a clinical instructor in addition to
Hmm.
what I do full time. And so being able to get my students into the OR is like almost impossible just because
Hmm.
hospitals are very protective of their
Hmm.
patients and for good reason, right? I mean, it is
Hmm.
an environment where you have to be very precise, you have to be very, very sterile, and you can't just let any and everybody in there, and
Right.
if they're
Yeah.
not really good with sterile field and understanding where they can be and what they can do and what they can touch and what they cannot touch, it can
Hmm.
be just another person in the way, right?
Yes.
And sometimes surgeons are not very welcoming to having extra people in their ORs.
Also,
And you could
yes.
probably to attest to that, right?
Yes.
So it is very fortunate that you got to be able to spend so much time in the OR because I think of all the clinicals I've taught over the last 6 years, I think one student has got to go to like the cath lab one time and
Yeah.
not for lack of me trying, but it's just
Hmm.
been, the facility did not allow students to go into the OR.
Yeah. I know that when we rotated to other hospitals, they didn't allow it. So I got very lucky that I just happened to get in the group that got to go to this hospital for 2 semesters in a row. Because the first one, when she said that they were rotating us to the OR, I said, yes, my mom did that. I would like to see what she loves so much. And then I just, from then on, just kept asking, can I go? Can I go? And so, yeah, I feel very lucky. I feel very lucky.
So, overall, this residency experience, how has it shaped your view of nursing and your future in the profession?
What do you mean? Like, how has it? I think I need that reworded. It's not
So,
clicking up.
how has the experience of being in a nurse residency program shaped your view of nursing versus if you had not been in a
Oh,
nurse residency program?
okay. I feel that the support and, like, I guess, helpfulness of everyone in the residency program has made it not as difficult, I think, as it would have been if I was just thrown in. Where, like I said, if I was just thrown in, I don't know that I would have lasted even 7 months, 8 months into this because, I mean, we all have anxiety, but I think it would have been too overwhelming. And I think the residency program really sets you up to succeed, um, and be a safe and successful nurse because it takes the time to teach you and give you those little, I don't know, areas where you can not where you can make mistakes, but where if you make mistakes, it's like, okay, well, you're still learning and we're here to teach you. And I think, yeah, that has eased the anxiety and made it to where I feel like I'm being set up for success and I can do this. I just don't think I could have done it if I was just thrown in. I really don't.
I'm so glad to hear that you feel so supportive. And I am really glad that nursing started having these nurse residencies. Like we do this for
Mm-hmm.
doctors, doctors get
Mm-hmm.
out of medical school and they're not expected to know everything from day one. They get that opportunity to go into their residency because there's only so much you can be exposed to in medical school.
Mm-hmm.
Just like in nursing school, when you're in clinical, there's only so much you can be exposed to that you still have a lot to learn and a lot to be
Yeah.
exposed to. And so
Yes.
these
There's so
residencies,
much.
I just feel have just really changed
Mm-hmm.
nursing and how we introduce new nursing people, new nurses to the profession. And we're keeping them longer.
Yes. Yep. Yeah. I just think it's a good transition from the stuff we learned in school, which isn't like real life, to, hey, I know this is what you learned in school, but this is what it's like in real life, and we're going to help you. We're going to hold your hand and help you. And yeah, I appreciate the residency program so much. I am so happy. Even if I was going to choose bedside, I would still want to be in a residency program. Like, I just think it's so helpful.
Well, I want to thank you so much, Amelia, for being with us today and sharing your story.
Yes, of
We are
course.
so happy that you've been here.
I am so happy to be here.
Hearing Amelia's story reminds us that growth happens in the challenge. The OR isn't just about precision, it's about teamwork, trust, and transformation. For every nurse stepping into residency, know that you're not alone. You're learning, evolving, and becoming. And that's exactly why we nurse. Thank you for joining me in this episode of Why We Nurse. If you found this conversation helpful or inspiring, share it with a fellow nurse or student. Follow us on Instagram at Why We Nurse for updates and behind-the-scenes content. Got a story to share or want to be a guest? Email me at whywenursepodcast@gmail.com. Until next time, stay strong, stay compassionate, and remember why you nurse.